So your excellencies and Gavi champions, ministers, friends, members of the Gavi family, I'm delighted to be here to talk a little bit more about the substance of what we do. We've had inspiring talks so far. We're going to start off talking about something you may not know about vaccines, and that is their reach. Worldwide, more than 30 vaccine doses are given every second through routine immunization programs on every continent, across the world, in the poorest countries of the world. What has this been able to do? We've eradicated smallpox. Polio is in the end game, 95% reduction in measles. We've had healthier lives and stronger communities as a result, and stronger economies. This is the power of vaccines. No other intervention touches so many lives on Earth, and that is what we have in front of us. So you've heard people talk about coverage. This is global coverage. You heard Tony talk yesterday about the attempt that was made in the 80s to get up to universal childhood immunization. You see 84%, that's 16% below everybody covered, and this is DPT-3, a tracer vaccine. But that hides the disparity that exists between high-income countries and Gavi-supported countries. And you can see that in the high-income countries, in fact, they've gotten to high levels very quickly. It's the low-income countries that we've seen come up to now 76%. And of course, that is the gap that we need to fill in terms of reaching people with this tracer vaccine. Now, you've heard that Gavi started modestly about 15 years ago with one vaccine, hepatitis B, which is a vaccine that is actually the first cancer vaccine against liver cancer. It went into the 5-in-1 vaccine you've heard talked about, pentavalent with Haemophilus influenza type B. You've heard Bill talk about pneumonia and diarrhea vaccines. Meningitis A, you heard a wonderful story about that earlier today. HPV, the second cancer vaccine. IPV, working with the polio eradication program, trying to help deal with the end game. And then you've also heard some discussion of Ebola. Obviously, we don't have an Ebola vaccine yet, but when it is proved effective, if it's still needed in this outbreak, we're prepared to take it out, but also to create a stockpile for it for future use, to work with manufacturers to make a better vaccine, and as Bill has said, to help rebuild the health systems in these countries which are so critical. So you've heard the amazing statistics. What have we done in the last 15 years? We've immunized, you've heard, more than 500 million children. But just to be clear, this is 500 million children with at least one vaccine. Many of these children have received 2, 3, 4, 5, 6. And this does not include campaigns. So we're talking about hundreds of millions more than this. And what has this resulted in? You've heard 7 million future deaths averted. And of course, with the campaigns, this number is even bigger. This is an extraordinary accomplishment. Preparing for this meeting, the Gavi board said we need to tell the investors what it is we're going to do in the next period. What are they buying? So we worked together to put a new strategy together. Core, the mission is to save children's lives and protect people's health by increasing the equitable use of vaccines in lower-income countries. That's the core mission. 4 strategies. The first, to accelerate equitable uptake and coverage of vaccines. Now, in the past, this was also a strategy, but really, the big push in the past was to roll out these new vaccines, as you've heard. In this next period, we're going to do something even more difficult. Yes, we will continue to roll out new vaccines, but what we're going to try to do is reach the unreached and try to deal with this equity issue. And that is something that is tough. The second goal is to increase the effectiveness and efficiency of immunization delivery as part of an integrated health system. And this is critical because vaccines don't deliver themselves. And I've already shown you this is the intervention that touches more lives on Earth. This is the base of the primary health system, the base of the pyramid. And so as we reach new people, we will be bringing them into the health system. And the critical issue is integrating the work we do in that, including the better data, including the work on logistics and cold chain, et cetera. The third strategy is to improve sustainability of national immunization programs. I will talk in a minute about the co-financing that Bill mentioned, but what's important is to think of one holistic budget. And that is working with countries to make sure that ministers of finance, not just ministers of health, and political leaders believe this is a good investment and will make sure that these continue to get funded. And finally, we've been working in market shaping. I'll also talk about that, but we've expanded this to say vaccines and other immunization products. Can we help in this cold chain area? Can we begin to replace, for example, cold chain with modern cold chain? And if we do that, can we use the buying power of Gavi, which is 60% of the world's children are being immunized with Gavi vaccines? This is a powerful marketplace. So we talked about DPT-3. That's the tracer vaccine. That's the number we talk about. That's the 1 in 5 that aren't immunized. Our goal, of course, at the end is to do the following, is to take the 11 vaccines that WHO recommends and try to get those to every child so we can give them the best protection possible and they can live up to their full potential. So when Gavi started in 2000, you can see that measles was up to 60%, as we discussed in coverage. The other vaccines were virtually non-existent. In fact, some of them, like pneumococcal vaccine, hadn't even been invented yet. What we saw is by 2015, we've begun to fill this in, and with the investments that are occurring today, I hope we're going to take that to a new level. So this is going to be to increase the numbers of children receiving these vaccines, but also to increase the number of children receiving vaccines. And that's going to be critical to prevent disease. Our partnership is based upon developing countries. They are at the core of this. We don't have people in the ground. We work with those governments. We strengthen their systems. They are the critical recipients of this work. But of course, when they need technical help, when we need to procure vaccines, we work with our partners. You've already seen up on the top and mentioned many times our 4 key partners, UNICEF, WHO, the bank, and the Bill and Melinda Gates Foundation. But we also work with donor governments, and they have bilateral programs on the ground. Civil society, a critical part of what we do, the manufacturers, academia, private sector. And we've been expanding this partnership, and in the next period, we'll expand it even more. We've brought in new private sector logistics companies like UPS. We've brought in civil society technical agencies like Agence Préventive Médecine. I got that backwards. We've also brought the African Development Bank has joined us. So we've brought lots of new partners forward, and that's part of what we're trying to do. The other issue that's really important is about integration. So there are the old vaccines, there are the new vaccines, there are vaccines that are being given by campaign, there are regional vaccines, emergency vaccines. It's important that these work together. We also have different modes of delivery. Obviously, we'd like to have clinics everywhere, but you've heard sometimes there needs to be outreach, and sometimes we have to use campaigns. But the critical issue is that campaigns shouldn't hurt the work in the clinics or in outreach. So how do we coordinate those? And finally, there are special initiatives that are critical. We need to eradicate polio. We need to eliminate measles. And the challenge is in those groups that are working very hard on that, how do we make sure that's integrated? Because in fact, all of these groups need health workers, data, financing, supply chain, using the same systems. And the challenge is how that builds a strong national immunization program and is integrated together, and then ultimately fits into the health system. This is going to be an important priority going forward. Now, our resource mobilization model, this is about resources, is really rather unique. It's this virtuous triangle that I'll talk about now. First of all, we try to work to improve the prices of vaccines for developing countries. These are the average high country prices, high-income country prices, compared to the prices that we have. You can see 90 to 95% reductions. And by the way, what we need are healthy vaccine markets. So it isn't just about price. It's about having adequate suppliers. It's about making sure that we have supply security. But obviously, for sustainability, price is critical. We're not happy with even those reductions. We've continued to work during this period to try to reduce prices, and you can see here, since the last replenishment conference, another 37% reduction, even over some of those big drops that we've seen before. Of course, at the end of the day, this isn't enough, and you can see, for example, in the 3 key vaccines that I'm talking about here, that the pneumococcal vaccine, a very complicated vaccine, has not gone down very much. We had an announcement yesterday of another a small price reduction. Obviously, we need to continue to work on that. There are only 2 manufacturers of that vaccine. As we begin to get other manufacturers in and create a healthy marketplace, we hopefully will see even more rapid reductions. And this is not only critical to save donor money, but it's also critical for sustainability and for the countries. And on that, we've changed the marketplace. When we started, we used 5 suppliers, 4 of the 5 in the developed world. Today, we have 16 suppliers, the majority in the developing world. And again, this creates a healthy marketplace and healthy competition. Now, this is our co-financing model, and again, it's rather unique. When you're a low-income country, you pay something. You pay 20 cents a dose. As you get wealthier, you move into an intermediate period, and you pay 15% more a year until finally you pass the threshold, which right now is $1,590. And then you enter the graduating period. You have 5 years to take on the full cost of your vaccines. As you notice, during this period, if we can bring the vaccine pricing down, that helps those countries sustain. And then they're graduated dealing with paying for these vaccines. Of course, what we were worried about was that particularly small countries might end up entering the marketplace and have to have problems procuring vaccines at a reasonable price. And so we're delighted that people have extended price for graduating countries, and we heard a whole range of those announcements last night, so that those countries will be able to get on their feet, be stable, have reliable finance before eventually, as they get wealthy, they need to pay more, which is the right thing to do. So you've heard about this, sustainability and financing, and in the last period, countries put in $0.47 billion, that's almost $500 million, and you can see that in this next period, they're increasing 250% their contributions and are going to be going to $1.2 billion. But that's not all they're doing. They invest in immunization. They pay for some of the routine vaccines, the healthcare workers, the system, and you can see that's a bigger number, $8 billion in the previous period, and estimated to be $12 billion in the next period. So this is important in terms of what they're doing. So coming back to the ask, we calculated what we needed for the next period, and that number was $9.5 billion. And I want to emphasize that this was an ambitious ask, but it was also a conservative ask, because, of course, if we had more money, we would be able to do more on equity, more on rolling out vaccines like HPV quicker, more on innovation that's so critical. We had $2 billion, and I want to emphasize part of that is, this incredible financing instrument, IFM, which many of you in the room have supported, that allow us to, over time, have predictability and long-term financing, and of course that helps with the vaccine manufacturers. So the ask was $7.5 billion. Now, what are you going to get for that? What do we buy? Well, here's what's happened over time. You can see in the first 5 years where we were, and you can see that there's been an acceleration over time. In this next period, 300 million additional children immunized, 5 to 6 million future deaths averted. Those are big numbers. How do you get your hands around that? It's easy to talk about one child. Well, let's give some examples. So every year, we will immunize 100 times the number of children that are born in Germany. That's a big number. And as another example, our annual investments will prevent almost as many deaths as cancer causes each year in the entire EU. These are really big numbers. And finally, just to say something about the economic impact of this, we estimate that it will have an economic impact of $80 to $100 billion. Again, a big number. How do we put that in perspective? We're here at a G7 meeting. So what does the G7 spend a year on overseas development aid? $95 billion, just to put that in perspective. So this is obviously a very, very good buy. So in this next period, we will actually be at the peak of Gavi's investments. Why is that? Well, in 11 to 15, we purchased and subsidized 2.1 billion doses of vaccine. 16 to 20, because of the increased coverage, because of the increased number of vaccines, it's going to be 2.7 billion doses. But then what's going to happen is countries are graduating. And as they graduate, they move out and take on their own cost. And so this is going to be the peak. We're going to see the cost coming down. That is why we've asked all of you to reach deep into your pockets and try to get us to the levels we need, because this really is an extraordinary accomplishment. Let me finish and just put this into perspective. All of us want to end extreme poverty. The world has moved so far on that, but has to move further. Our goal at Gavi is to try to reach and protect all children with vaccines. That's an important part of that. We want to ensure a world free of vaccine-preventable disease, a very ambitious goal. And of course, we are part of ending all preventable child and maternal deaths. So this is what we promised to you. This is what we're trying to sell to the world with this replenishment, and I thank you for your attention.